Hello, everyone, and welcome to this webinar where the topic today is the Danish conversational and read-aloud speech data set, also going by the name CoRal. This is our second edition of the CoRal project in a webinar setting. We had a webinar back in 2023, I believe, and we are very excited to hear what's happened in the meantime with this project. Torben Black, Senior Project Manager at Alexandra Institute. We hope that you will give us an update on where you're at the moment. And also welcome to you, Lars Målø. You are the co-founder and CTO at Corti, and you are situated in the United States at this point, right? Can you maybe perhaps tell us
Yes,
where
I
you
am.
are?
I'm sitting in New York, living in New York full time and working out of our offices here in Dumbo, Brooklyn.
Right. Okay. Well, greetings from Denmark, and we are very happy that you got up early today to be joining us at this webinar. So thank you so much for joining us. But before I will leave the floor to you, Lars, I would like to start off with you, Torben. And I would like to start by asking you, since the last time we had our webinar, you've collected a lot of data, as I understand. Now, on a scale from 1 to 10, where would you rank your happiness with this data collection, or your satisfaction?
Well, I'm actually quite pleased with the whole data collection process and sort of the awareness that the project has received so far. We are still not done. We still have about half a year to go, which is where we're going to spend a lot more time on the model training and the actual outcome of the data collection. But with regards to the data collection, I think that has turned out to be hard, but I think it turned out to be very well received, and I think we sort of received some very good results. So it's probably a 9.
Oh, that's pretty good. That's not bad. But now, before I leave the floor to you, Torben, I would just like to mention here that our dear collaborator, Martin Carsten Nielsen from Alvenia, unfortunately won't be joining us today, meaning that you, Torben, well, you will present some of this data. You will also be outlining the purpose of this whole project, and you will also be giving us, as I understand, an update on this machine learning and how the models have been trained. And finally, you, Lars, will be perhaps sharing your great perspective and the future outlook of this data set. Just to mention a couple of things. So we're happy to have you both on board. But without further ado, I will leave it to you, Tom. And thank you so much for joining us out there in the crowd. Sit back, relax, and collect all your questions in the Q&A box if you have any along the way. Thank you for joining, everybody.
Okay, thank you very much for the introduction, and I'll do my best to cover some of the stuff with regards to especially the model training that Martin was intended to cover, and just to sort of set the expectation level. I of course do not have the knowledge that Martin has in the area, but I'll try to present our results as good as I can based on where I am. Thank you very much for everybody for attending this episode 2 of the CoRal adventure. We are now on the 3rd year of a 3-year project, which is a pretty large project, sort of supported by the Innovation Fund in Denmark, and which is a collaboration between a number of different actors in this area. I'll get back to that in a little time. As such, we are now very close to have finished the data collection part. We have started the model training and starting to get the first results out. We published the first data, we published the first models, and that's some of the things that we'll continue to do in the future or in the rest of the year. But for those of you who didn't see episode 1, we always start with a small recap about what it's all about. And the whole vision of this project was to build a Danish speech dataset to elevate and support Danish speech technology. The purpose or the effect we would expect to get out of this was to support companies, universities, others dealing with speech technology, providing with data in a high quality, providing models to companies and other stakeholders to allow them to incorporate speech technology in their applications, in technology in general, and society in general. And as such, just to speak a little bit about that, I can say that now, after we've been dealing with a lot of people who actually participated in this data collection, this has actually given me a little an extra view on the importance of a project like this. Just to tell you a few stories I've heard now from all the persons that have participated in the project so far. There's a few stories who actually sort of put this a bit in perspective for me, because we talked to a lot of persons who volunteered to donate their voice in this project, and it made quite a big impression. Just a few of them was, of course, all the persons who participate with different dialects, who told me about speech solutions that doesn't support Danish at all, who doesn't support them to the extent that they could actually use it for something. That is due to maybe their dialects. That could be one example. There's been an example lately where a municipality here in Denmark had to scrap a voice bot in the municipality because it simply didn't understand the dialect of the area, so they had to scrap it at all. But a few other stories was actually one who made a big impression to me was a young woman who was actually standing in line to donate her voice, and I asked her why she was actually interested in donating her voice, and the reason she did, she said, this is important because I'm actually dyslexic, and I've got this tool to support me in my writing process. But I have the disadvantage that I come from Fyn here in Denmark. I speak with a dialect, and there's a big problem in the solution that I have today, that it doesn't understand everything I say. So I would like to support this project because it's important that these speech solutions also support me and others who speak with a dialect. And then there's a few other stories. There is, for example, a guy called Sebastian who called me and said, I would like to donate my voice. I have cerebral paralysis. And the problem is with the current solutions, they simply don't understand what I'm saying because I have a different way of talking that ordinary or than other people's do. So they simply have a problem to understand me. So I think it's important that we actually try to do this to support as many people as possible. Of course, this is a bit out of scope of the general aspects of this, but it just, for me, proves the importance that we actually support everybody when we do technology, and we try to support all different kinds of ages, dialects, and basically the whole Danish community when we also develop technology. All right, enough about that. A bit about me. My name is Torben Black. I'm a senior project manager here at the Alexandra Institute. I work in the part of the Alexandra Institute that's called AI Lab, where we're specializing in AI solution. I'm so fortunate that I am focused on the different projects that are dealing with especially the Danish language, but also LLMs and both in speech but also in text. So I'm a project manager for a number of projects here at Alexandra Institute. There, of course, CoRal, which is the topic of today, but I'm also managing the DSK, the Danish Language Model Consortium, is trying to collect data across Denmark. DFM, which is currently working on developing a Danish LLM, and I'm also managing the Danish part of Trust LLM, which is an EU project developing an LLM for the Germanic languages. So I'm doing a lot for especially the Danish language in general in both speech and text currently, and that is a very interesting part of the world. A bit about the Alexandra Institute. We are what's in Danish is called a GTS Institute, an RTO, which is a non-profit institution which is supported by public funding, among other things, but also dealing with commercial projects as an ordinary consultancy company. We work with what's called applied IT research and development, where we try to bridge the universities and the commercial players in Denmark, trying to bring out the latest research technology and bring it into play into the Danish companies, but at the same time bring the requirements and the needs from the Danish companies back into the universities to try to shape the research and the way we target that part of that. So we're trying to bring together latest research and the Danish industry, and that's why this project writes something that supports that role for us. The focus here on the CoRal project, I'll make this brief for all those who've seen it first, but the thing here in Denmark is that and in the world in general, that speech technology is growing at a very high rate. The interest and the need for speech technology is increasing. But Denmark, as it is today, is what you could call a low resource language. There is very few resources in the area due to several aspects. We're a small country. Of course, that means that it's not necessarily of big interest for the big players, the big tech players in the area, to focus on Danish as a language. So that's one thing. Maybe there's not the necessary focus on this, at least from a Danish perspective, but also because we don't have a lot of Danish data available. So that means it makes it very hard to actually develop something, because the amount of data is for so far quite limited. Why is it limited? And there's two main purposes for that. One thing is speech data are expensive to produce, because it requires you to actually find a person to record what he's saying and maybe transcribe or annotate what he's saying. That is a very expensive process, which I'll get back to a little later. But also because there are so few of us, and when you do it, there is a tendency that because it's expensive, then you actually select very few demographies and try to collect data from a few democracies, and of course you focus on the one that most people understand. That is what we would probably in Danish call rigsdansk. So if you go for a sort of a middle-aged persons who speak rigsdansk, then you would actually have the language, the data that most understand, which is fine. That is the most economic way of actually dealing with things, but it's also a thing that actually leaves out some demographics. What we would like to do is of course that we would try to make it possible for Danish companies to compete in this area, but also to support Denmark as a democracy. So we try to support Denmark in a way that also our technology is something that it can sort of be approached by everyone across age and across dialects. So it's both a technology project, but as I see it, it's actually also you could call it a technological democracy project, where you actually try to create solutions that will support some of the democracies or some of the demographies that are not supported that well today in the current solutions. This is who we are. The partners in the project are us as Alexandra Institute. It is the University of Copenhagen, and it's the two companies, Alvenir, where you know Martin from, and Corti, which Lars is probably going to introduce and tell us a little bit about a little later. We also have a party here that is called the Digitaliseringsstyrelsen, or the Agency for Digital Government in Denmark, who are actually also a project participant in the project. And we have a sounding board or following group that's actually following us, which is mainly consisting of a number of players in the commercial world who have a lot of experience in the area. It's mainly the person group you can see here, where both I and a few others are mentioned. I'm not going to go into detail about that. What was our aim? It was to basically to create a high quality data set that was freely available. That means that we would collect a data set consisting of two different types of data. One that you could call conversational speech, or højtlæsning på dansk, and a dialogue, which is people talking together, and it is two different types. It sounds a bit like it's the same thing, but it's actually two different types of data, where you could say that the conversational speech is of a very higher quality, because when you do conversation, you have a tendency to speak in another way. For example, the dialogues is much clearer, especially when you have two persons coming from the same geographical area. Then you could say the dialect shines a lot more, and you get a lot more variations of the language. But it's also an expensive data type to create. So that's why you have the read-aloud data, where you actually read something aloud, where you actually have the text in advance. So you just basically have to record the text, and then maybe validate that they actually say what's written down. So that was our purpose, to collect these data, and a data set about between 1,000 hours and 1,500 hours, and I can say that we will definitely meet the minimum requirement here in the data collection. All this data is going to be released as open source, so everybody can basically use the data. We're also, as part of the project, going to release a number of models, speech models, both speech-to-text models, but also text-to-speech models. And then we're going to dig a little deeper into some specific models, where we're going to do some research, especially on the dialect area, where we're going to try to create models who are fine-tuned towards specific dialect areas, to see if we can actually make specific models that could be targeted towards people on Bornholm, for example. So could you actually achieve an improvement in the recognition rate if you try to fine-tune the models against a very, very specific dialect? I don't have the answer to that yet. We are actually working on that at the moment. So just to mention that we're going to get back to it. But all these models are going to be released as open source as well, for everybody to actually use them and rework them in both for research, but also for commercial use. So it's free for everybody. This is kind of the implementation project pipeline, and now we're in 2025, and we have reached the final stages where we are going to focus on creating the models as the part of it, but also release the models and try to get an outreach on this, and try to look more into how this can be used, how companies can use the models and use the data. And our target is to have a pretty large number of companies involved in this, but also companies and other stakeholders using the data sets in 2028. And apart from that, there is a number of research activities going on, especially performed by Copenhagen University, that has already released a number of research papers based on the topic of speech recognition. And we already released a number of these papers. And I can also say at the moment, for those of you who are interested in it, we're gonna have a conference at the end of the year. There is no specific date at the moment, but you're of course all invited, where we're gonna go much more into detail with the all the different areas of this, and also some of the research topics that we have covered in the project. But that's going to be at the end of this year. All right. Getting to the actual work that has been involved in this. You might remember this from last time, but the whole data set creation was intended to be done in a number of iterations. Starting out where we had a plan of actually recruiting a number of people, doing recordings, validate the input, annotate and transcribe the data, release the data, develop models, and evaluate. And then based on the models, we would look into what do we need more from, and then do a next iteration where we will actually focus potentially in a new area. And just to mention the focus areas we had was basically, first of all, we could see that there were some lack of coverage in some of the dialect areas. So iteration 2 were focused on, for example, to get more persons from Fyn and especially from Bornholm, which was quite underrepresented in the data set so far, though they were actually sort of focus areas in iteration 2. And in some of the later iterations, we had a specific focus on people with accents, and people with accents in our world is defined as people who has moved to Denmark at an age of 15 or more, because they've had sort of you could say their fundamental language training somewhere else in the world, and was expected to speak with some kind of dialect. So they are considered as being someone with another with an accent as such from a data set of level. So that's how it was done. First iteration had a sort of a diversity focus and sort of dialect focus. So we were looking into the dialect areas. We have about 32 dialect areas in Denmark. We cut it down to actually 12 different areas. So we boiled it down to 7 necessary dialects that we have to cover. For example, from Bornholm, and then others who could be interesting to involve in this. And then we needed to have some people with accent. Then we had a target to say that we should actually have an equal gender representation. So we should have about 40 or at least 45% of each sex covered in the data set, which was a bit harder to reach. And I'll get back to that in a little while, because that's actually one of the targets we did not meet. Then we had a sort of another target with regard to age, that we should cover the different age group below 25 years old, between 25 and 50 years, and above 50 years. So we had a broad coverage of data points from different age groups. Now we can sort of move into the actual war stories, because all that was planning and what we intended to do. So now I'm going to tell you a little bit about how it was actually done, and show you a few photos about what was out there, and some of the let's say the obstacles we met along the way. The data collection was actually performed in close collaboration with the Danish libraries, and I can already by now say that we are very grateful for that collaboration with the libraries. They were quite the right partner for us to work with, because they could help us out with a few things that is very difficult to handle from a central point. That is to have the right location in all the different parts of Denmark, from the north to the south and from east to west, to find rooms that are available with the right conditions, and especially to recruit the people who are expected to donate their voice. It is not everybody who's been working with recruiting volunteers knows that is really hard work, and we've had a great help from the libraries, using their existing communication channels to reach out to all the users of the libraries around Denmark. Try to get people to sign up and to actually arrive to a recording session with us. The recording session was conducted by a group of student workers that we trained to do the work, who helped us, traveled around in Denmark to a large number of locations across Denmark to do the actual recording sessions. The recording sessions were performed in a way that you can actually see on the photos to the right here. Of course, this is not a studio. The intention for us was to create the recordings in a quality that was as high as possible. And as you can already see here, it is very different conditions that we have. Some libraries have actually sort of designated podcast studios, so they had perfect conditions. In other occasions, we were met with very, very large rooms with not, from a sound perspective, not very ideal setup, but that's what we had to deal with. So we could try to limit the noise as much as possible to do the recordings with the same equipment across Denmark, with the same configurations. We could add extra information, metadata, to our recordings that tells us a little bit about the background noise levels in the rooms, the room sizes. So everybody who wants to look into this at a later stage and try to see that, could be, or try to investigate that further, are more than welcome to look into the dataset and actually try to use this information for something if it can be used. We have recorded everything and we've published everything. So look into it if you think it's an interesting area. But this is what we used. So our student workers, the recordings team traveling around, was welcoming the people. They signed a contract with us that basically told them that they donated their voice, and it was to be released as open source. And we had the rights to release this as open source. And in return, they received a gift card that they could use for anything they basically wanted. So we do have a written contract with all the participants in the project that allows us to use the data, and that is something that was very important for us to actually to look into, because especially the legal aspects of AI training is something that is has a large focus at the moment, which is quite important, and also to actually to act according to Danish law. So we actually had this contract reviewed by the Danish data protection agency, who are looking into this and has actually approved the contract with a number of different comments towards this. We had some questions about anonymization, something about biometric recognition. If someone wants to look into it, feel free to reach out to me. There were some interesting conclusions into this, but all of them were actually conclusions that supported us, that we are allowed to collect these data with this specific purpose, and actually to publish the data. So everybody signs a contract. They are invited into the room where they actually did 2 different sides of recording sessions. They did 1 hour of Read-aloud, which was divided into 3 minor sessions where they were presented with a number of sentences that they were intended to read aloud. Then they were actually we put some headphones on them, and we presented them with some traffic noise or with some speak noise, basically to force them into using their voice in a bit of a different way. We all have the tendency that when we're in a noiseful environment, that we actually speak a little louder and a little more clear, and that is some of the effects that we wanted to do here. So we actually wanted to impose different types of noise into the persons doing the recording to create some kind of different speech variations. After that, they were put together with another participant, and that's actually the setup you can see at the bottom down there, where they were doing a dialogue in about an hour of topics of their own choice, excluding things that were something that was PII, so that could identify them as persons, and especially something with sensible personal information that were sort of that's written on the paper that you can see. Do not mention education, religion, sexuality, or any other things that is actually critical for this. We are reviewing all this afterwards, but of course, the more they can avoid it at the recording, the better. So they had a free speech of a dialogue in about an hour, and to support them, as you can also see on the photo, they had some picture cards that they could actually use to support a dialogue if it was a little slow. And here was actually probably one of the first learnings that we had in the project, because this was one of the things that we were a bit concerned about. How would that actually turn out? Us Danes are probably well known to be a little maybe introvert and maybe not being that good at reaching out to other persons. But that stereotype was a bit put to shame here, because even if we put two random Danish persons in the same room and asked them to talk together, they actually did it. And it was extremely positive received. We had random persons actually exchanging telephone numbers after the recording, because they thought it was so interesting to talk to each other about these topics. So there was a lot of good energy in the room, and we've only met about 2 people who actually sort of came back and said, no, we don't speak with people we don't know. We are not comfortable with the situation. We want to sort of bail out of this. So it's 2 out of more than 1,000 persons who actually sort of bailed out of the dialogue session. So it was very positive received, and we Danes we can actually talk to a foreigner. It's not that hard. After the recording, all the data are anonymized. We remove all information about the persons. We remove the names. We remove email addresses and other kind of information that we have recorded as part of the session. Transfer everything to a secure server, and then basically all this is a data set that we can use for this. We store a number of metadata about the recording, as I mentioned, something about the room, but also about of course, the age where they were born, their dialects, and so on. So all this information is available as metadata to the data set. A few photos, just a few situation photos from different libraries. It just shows you a little bit about the difference between the studio sessions in the different areas. But this is just a few photos from around Denmark. We also had a sort of a few other sessions that I'll just show you a little bit about. We had a mobile studio that we used at a number of occasions. We performed at a science fair that was here in Aarhus last year, and we were actually also present at Sprogense. There's a Danish language festival in Fyn that was in the beginning of this month, where we were actually out with our mobile studio, as you can see on the photo, where we actually did sort of very short recordings on the street, trying to collect voices from some random bypassers in the street, and it actually was quite a success. A lot of people was actually showing interest into this area, and it actually allowed us to collect some data that way as well. And so far we have had a couple of digitization ministers actually also performing as part of this project. We've had a few of them during the last 2 years, and at the bottom it was actually the minister who were there at Marie Bjerre, who were there when we started, and at the top we had a demo of our project with our current digitalization minister a few weeks ago, where we actually were showing her about something about the project. But in general, we've received a lot of awareness about this project, and especially the dialect angle was something that was received very well in the different medias, especially in TV2, who has been covering us a lot in the different regions of Denmark, but also a large number of especially newspapers and local newspapers were very interested in actually sort of picking up the angle of us trying to do something for their area, trying to collect data to make technology understand persons from especially west of Denmark or the more, let's say, dialect aware areas of Denmark, make technology understand them. And just to get you a little bit of impression about how many places we've actually been, all the blue dots here is actually places where we've actually traveled, and we conducted recordings in at least one day in several of the places we've have been doing recordings for more than one day around Denmark. And we actually came to a point now where we actually been in most of the Danish cities where we have at least 10,000 persons living. So we've been most places in Denmark, and at least more than once. Only a very few places which we would like to have had received, for example, Samsø, where we tried, but we simply couldn't sort of gather enough volunteers to donate their voice on Samsø to make it available make it possible for us to cover the cost to get there. But we've been around. So where are we doing? And this is where we are in March, and we've been doing recording since. So just so you get an impression about where we are. Currently, or rather in March, we collected close to 900 hours, where we have about 277 hours of dialogue recordings. Not all of it has been made public yet, but it will be, and that's also why I can say that we will definitely reach our minimum requirement of 1,000 hours recordings. We have at current about more than 300,000 different sentences recorded, and about 892 different dialogues between different persons, and involving more than 1,000 speakers recording their voice across Denmark, where we've actually been in 77 different locations across Denmark at the moment. We have been recording for more than 60 days at the moment, and we have covered all the dialect areas of Denmark, so you will be able to find samples of dialects of all parts of Denmark at the moment, which is something we are quite proud of. But for those who wonder about one thing, and that is about the gender, and that's why is there 70% of women in there? Why is it not? Why don't we have an equal distribution of this? And that has something to do with the demography of the libraries who assisted us. Because if you look at the typical user at the libraries today, it is actually, you could say, a woman with an age of more than 50 who are very sort of cultural aware. That is the typical library user. And of course, that is also the group of people that they had easiest access to. And that means that most of the people who were volunteering was actually also in that specific demographic segment. So we simply had most people from sort of an older age group, and especially women coming in from the libraries. We did a targeted sort of recruiting to make sure that we also could reach the group of especially persons below 25, because they are not, at least not at the moment, the typical user of the libraries. So we had to do a special effort to reach them, and the same goes for people with accents. They are probably not the typical user of libraries. So that's kind of the tricky part of the aspects in this. I'll show you the numbers a little later. But this is the sample count that we have across the different regions of Denmark, and as you can see, we are pretty well covered in the middle of Jutland and in the Copenhagen area. If you could say that there's an area where we are not as good covered, that is in the rest of Zealand, and especially in the south part of the islands of Falster and Møn. It's been quite difficult actually. We did our best to actually recruit people in that part of the world, but it turned out that if you look at the number of cities in this part of Denmark, there is very few cities with more than 6,000 inhabitants. So it's been very hard to actually collect enough persons in that area to get more. We would like to have more, but that's it. That is what we could achieve within in our possibilities. And that is also the same you can actually see in this dialect distribution. We have persons from all of the areas, but this is called Sydømål. That is actually the area I mentioned before. That going to Møn or Lolland and Falster is actually where we have the smallest representation of persons in the data set. But that is how far we could actually reach. In the rest of them, we are very well covered, and also in the island of Bornholm, where we had a lot of people showing interest in actually donating their voice. The age groups, as you can see, we still have more persons in the 50+ age group than we have in the other areas. The 0 to 25 age group is where we have the least. And that is despite that we actually did a very big effort in actually sort of trying to attract people from especially the educational system, where we tried to recruit in that area, and we did quite well. The numbers were worse, but this is where we could actually make it to. And then you have the gender distribution with a majority of females and less males. And then you could say, isn't this a big problem? And actually, we don't see it as that big of a problem, because if you see the representation in the available data sets that you have today, then you actually would see that there is a large overrepresentation of male data in the current data sets. So if we create a new data set with a larger representation of female data, that would be perfectly okay. It wouldn't change everything. It would basically probably just support the imbalance that there are in the current data sets. And that actually goes for the age groups, where you actually in the current data sets available see an underrepresentation of the older age group, and that is also the group of persons who are actually performing the worst in the current models that are available. So actually doing a little more effort into that area will not do anything harmful. It will actually sort of probably more actually support our aim at actually creating something that is more balanced here in Denmark. A few things about the work on the data afterwards. Of course, the one that's read aloud, as I mentioned, we already have the text. We just have to make sure that they say what is intended to say. But then we actually have the transcribed data available. But for the dialect, we have to transcribe everything, and the transcription was done by linguistics students at Copenhagen University. It was done in a way that they actually listen to the recordings. They use this open source tool called Aegis Sub to actually create timestamps and annotate everything. They have more work than actually do annotation, because they also have to secure that the data does not contain any PI, no personal information. So they also validate and remove any PI in the data. So if someone says that their full name, for example, we make sure that it does not reach the open source data set. So we've actually ensured that our data sets are aligned with the GDPR. So they both have the work of actually sort of transcribing, but they also have the job of actually ensuring that we do not pass forward any PI in the data we do. What our experience, that this is really hard work. We had a budget of about 3 to 4 minutes of transcription time per minute of recording. The reality is that we spend about 6 minutes per minute of sound recorded. So that means for 1 hour of dialogue, it takes us almost a working day to actually transcribe that data. And what does that look like? It looks like this. This is what the students or what the linguists actually create. recreate files like this. And this is an example of an introduction. You can see here already in the first line that they start out saying, yeah. And then they actually start by, despite we say that they should not mention their name, this subject A actually started by mentioning their name. So we removed that information and call them subject A. Gitte has not been removed as a generic term, so that's subject B. And then we start out. And then we actually, you can see that there's like a timestamp here of the start of the sentence and the end of the sentence. And then it's a long, hard work of actually going through this. Just so you can get an impression about this, how we actually keep track of this. This is just some of our internal tools. This is where we keep track of all the different dialogues that we actually transcribed, and just so you get an impression about what's in it. As you can see, for example, here is you can't understand what's being said in segment 125, 109. There's a PI in the following segments. There's something that is, for example, this one. This is full of PI, should just be removed. So here is basically two persons who haven't been able to keep the personal information out of the dialogue. So we'll probably have to remove the whole dialogue that has been recorded for that session. And then there's something, and then with a few sort of internal comments to say, we don't understand this, and then the good dialect from Nordjylland coming in here. So it's hard work to actually do this kind of work, and that's one of the reasons why it's so expensive to actually create a good data set based on Danish or in any other language for that sake. But that was something about the transcription. That's all I'm going to say about that. If anybody of you wants to look into it, you can actually find the data on Hugging Face where it has been released so far. It has been public released, and you can actually go in and if you just want to sort of browse around in there, maybe just for the fun of it, you can actually go in there and you can try to find a dialect, and you can actually sort of play the different segments and listen to the different dialects and the different recordings that you see in here. And we are evaluating other channels of actually publishing this data. Currently, it's only available on Hugging Face, as it's kind of the sort of default standard for de facto standard for this kind of material. But we are probably going to release it on the EU language data space as a kind of a prototype in another way. But that's another topic. Just a few things, because that's another thing we actually looked into as part of this project, because the intention for this was actually to release the data set and the models under open source, and we actually did that, but we couldn't use a complete open source or let's say a standard open source like CC0 for the release of this. So we actually had to do a special license to release this, because we did have two things that was actually required to put in as a condition into the release. So basically, it is an open source license, so everybody can use the data set, everybody can use the models, they can be used commercial, but there are two major things that are very important that needs to be included in the license. The first thing, you are not allowed to use this data set to do biometric identification of the speakers in the data set. So it was investigated as part of the legal process, and the feedback from the Danish Board of Data Protection Board was that it is possible. It is very likely that it's possible to identify persons by the biometric data. So it's not allowed to use this data for this. That's one thing. And the second thing, it's not allowed to use this data set to do synthetic data based on the persons in the data set. And that is mainly because of respect for the persons who donated their voice. We do not want these persons to actually be used as a synthetic voices in any solutions where they could actually be used for either to impersonate them or to misuse them in a way that could actually do them any harm. So you can't use these data to create synthetic data. If you want to do that, then we have actually released as part of the project another data set where we have released an open source data set with 2 different voices that you can use for synthetic data. And that has also been released under the CoRal project Hugging Face dataset. So you are free to use that. That is data where we have acquired sort of professional speakers to do the same recordings with the same data sets, and they are fully allowed to be used for synthetic data. So please use those and do not use the data set where we have the volunteers for this. Apart from that, that's it. Okay, that's all I'm going to say about data. Now I'm going to move into the models and training and the results that we received with that.
Thank you very much, Tom. Let me just quickly interrupt you here. Sorry that we might not have quite as much time for this part, because we need to go to last and a discussion as well. But thank you so much for this very, very thorough and informative talk so far. So please carry on.
Okay, thank you. I'll just go very briefly. I have a few slides on this one about sort of the result of this. We are going to release a number of models based on this. We have already by now released I can see a misspelling, a wave-to-vec model and a whisper large model based on the current data sets. We are building on the two models coming from Meta and OpenAI, which are both open source data set. Most of you are probably familiar with the 2 models. And then we're going to release some specific dialect models and some TTS models based on this. There's a few we're dealing with at the moment, and we have more along the way. But now I'm going to take you to sort of some of the interesting part to this, and this is some of the actually one of the last slides. Then I'm done with my part of this. First of all, does this work out? And does adding this kind of data actually improve the performance of the models? And yes, it does. First of all, what we have also created as part of this, we have actually created an evaluation or a test data set that allows you to test your current solutions across the different demographies. So you can actually now test the different models, how they work across the different dialects. And that's what you see down here. You can also create based on that test set across the different age groups, and you can test across the male females here. But let's start out at the right, because this shows sort of the overall effect. This is the results, and that's what's called the character error rate. So that is how well does it actually recognize this data, this test set of the different models. And let's start out with the green one, because that's actually the Whisper Large V3 model. That is basically the model that you can get sort of out of the box, where if you use the current Whisper model as provided by OpenAI, and the Whisper model is basically considered as probably the best out of the box model that you can actually use today, and it performs pretty well in Danish. You can see it's the green one here. Then we have fine-tuned it on the CoRal dataset and reached actually the level down here. So that's the gray one you see in the middle. That is our performance of the same model, which has been fine-tuned of our data sets, as you have just seen. So it improves the performance considerably, this data set. And then something difficult happened. I'm not going to go into that but I'll just say it improved the performance of the calls, at least on our test set here. The wave-to-vec model, that is the ones you see out here, has also seen an improvement. And now, just so you know, the V1 was our first model that we released in September last year. V2 was with additional data. So what you can also see from especially for the wave-to-vec models here, is that first, just by adding some Danish data improves the model. Adding extra data does not improve that much. So it also means that we can improve the model, but maybe not to the same extent as we did in the first go. So yes, we have made better models that existed previously. Then a few comments on what you see here across the board here, because now you can also see some of the things that we assumed, but we have now the tests that actually proves this. That Whisper as such, you can see it actually performs very well in the Zealand dialect, and it actually performs very well in the northern part of Jutland and in Copenhagen. But now compared to southern Jutland, west of Jutland, Bornholm, you'll actually see that the character error rate in the standard Whisper model is actually way worse. So this actually proves that the current models actually performs worse in the dialect areas than it does on other parts of Denmark. So there is work to be done to improve the recognition of these persons as well. Do we remove it by adding our dataset? No, there is still a difference between the performance across this, but because we improve it, of course, the difference becomes smaller. But there is, of course, still a difference in the models across the dialects. You can also see here that there is actually a difference out of the box of the different age groups. Out of the box, it does perform worse in among older persons than younger persons. Do we change that? Yes, we do change that. If you look at the gray area, it does improve that. At least the difference is not the same. There is a difference. We do not remove it, but we made the difference smaller. Is there a difference between the ability to recognize between a female voice and a male voice? Yes, there is. Whisper model does recognize the female voice worse than it does the male voice. Do we remove it? No. Do we make the less pronounced? Yes, we do. So yes, it does have an impact in the current models by fine-tuning them with additional data set. So as such, and the status so far is that yes, we do make an improvement. We have created a data set and we have improved this across the board. And this is a part we are working with at the moment. There are still more data to come. We are not completed with especially the conversational data sets. They have not been fully implemented in the training yet. They have not been fully transcribed as such yet. So they will be included. We will do more training and there will be more models here at the rest of this year. You can find them in the links here if you're interested. And as such, I can share that, or Jeppe can share that with you after the meeting here. What's happening at the rest of the year? Well, we are here at the timeline here. We are stopping our production of data at the moment. We have done our last collection of data. We have still some transcription to be done until after the summer holidays before we are finalized with the conversational data. Then we'll do our last training at the end of the year, ending out with some models that's going to be released at the end of the year at the same time with the conference that I was mentioning in the beginning. So basically, this is where the project is at the moment. We've finalized the data collection. We are now looking more and more into model building and trying to improve the current models, and they will all be released as open source. Some have already been released, and the rest of them are going to be released at the last half of this year. And yeah, I mentioned that already. Just so it's something that we already know. It's very hard to recruit. It's even harder to actually transcribe. Even with a small amount, we can improve the general models. We basically just did the first training. The V1 training was just by adding 373 hours of data, Danish data. That improved it quite a lot, as you could see. So the expectancy is, of course, that we'll improve it more when we add 1,000 in total. What we also see now that is there is work to be done, for example, with the ability to add noise to the data set, because we haven't been doing anything in that area. So it might not be as robust as we wanted across the board when you add some noise or you are in noisy sort of surroundings. But that's something we potentially will look into. And that was all I had to say. That was the current status of the project from a data collection and from a model training point of view. And I hope some of you will participate in the conference that we are going to do later this year. Then we'll do the sum up of all the findings.
Thank you very much, Torben. That's very, very exciting stuff, interesting stuff here, and very, very detailed. So really appreciate that for your thorough presentation here. Now we will head over to the New York office, and Lars Målø, can you please take over from here? I will just be mentioning once again that you are the co-founder and CTO at Corti. So maybe you can elaborate a bit on your part as Corti, and maybe also give a short presentation of yourself, because I haven't been able to get a hold of a biography of you. So that would be great as well. And then we've got about almost half an hour before we finish off here, and we'll also do a quick Q&A session where you can leave all your questions in the Q&A box. There's already questions there, so please feel free to do that. But without further ado, Lars, please take it away. And you need to unmute.
Yes, sounds good.
Yes.
I just wanted to make sure that the sharing is working, but you get it in this weird
Yes.
full screen mode here. Apologies for that. So first and foremost, thank you so much, Torben. You are the centroid of this project, so to speak, here, and I'm only a mere recipient, so to speak, and also in some instances, hopefully a helping hand in terms of application use cases for this project. Quickly, Corti, we built the AI for every healthcare app. What does that mean? It means that we believe that every application out there in the healthcare space needs AI. And in order to do that, we need to build good and trustworthy, accurate, and so forth AI solutions. And that means that if we want to do that, we need to understand what is being said inside the consultations, or else we will be drawn offsite directly. So hence why the CoRal project is so important and instrumental for an organization like ours. Just a quick motivation for having a company like ours. We're right now covering approximately 92 million patient interactions per year. We are in Europe, across Europe. You see the countries here: Norway, Sweden, Denmark, UK, Germany, France, Italy, and Spain, and soon more to be published. And we are in the US. We are continuously researching on improving artificial intelligence for healthcare, and we are continuously finding out that the out-of-the-box solutions, similar to what Torben is also rightfully saying on the Whisper version 3 models and so forth, they simply don't cut it for a verticalized domain like healthcare, where you have hundreds of thousands of specialized terms and so on, medications that are coming out all the time, and there's no real opportunity for error. We believe that healthcare is in need of AI solutions. There are quite a lot of mistakes within healthcare. There's a nice Mayo Clinic study that is actually showing that 88% of diagnoses are altered if visited by a second opinion. Which is not an indication of the human beings not being good enough, etc. It's just an indication that healthcare is difficult, and it's very specialized, and it's expert driven, and people are stressed. We see on the stress curves here that burnout is a massive issue. It's a massive issue for anyone that knows a doctor or a nurse in their family. They know that they are under a heavy burden. We see that some of that burden is that they're spending more and more time on administrative and documentation burdens. This study is saying 35%. There are studies for that ranges from 25% all the way up to 50%. I think that this study is one of the more reliable ones, stating 35% of the time actually spent by a doctor or nurse is spent on documentation burden. Imagine that time could actually be spent with the patient instead. Furthermore, there is a rapid increase in administrative personnel throughout the healthcare sector. It's getting more and more complex, and thereby the healthcare sector is trying to hire more administrative staff to take on a lot of that complexity. On the sad side here, we see that a large amount of the happiness within the healthcare provider space is not as good as it could be, and 26% of healthcare providers, doctors and nurses and so forth, are contemplating on leaving. And finally, WHO is estimating that there is a lack of 10 million healthcare providers by 2030. So, is AI the cure? Hopefully it is. I think that, to be quite honest, my background is machine learning and so forth. So I'm, of course, very, very biased. But I think that it's the only thing that can actually make this healthcare system really, really scale. Because there is really a need for supporting solutions that can automate and support healthcare professionals. Basically, this Accenture report is stating that 40% of the healthcare industry's total working hours are devoted to language-based tasks, and all of those language-based tasks, given the evolution of large language models and so forth, could potentially be solved for by AI, or at least supported radically by AI. It's also our belief as a company, but there is a problem here. And that means that everyone that has tried to use deep research or some tools like that, and have really dove deep into the complexities of large language models, have tried hallucinations. And these hallucinations are getting more and more opaque and difficult to find, and all of that because the large language models are also getting better and better. So that goes hand in hand. It's similar to if you want to call bullshit on a professor saying something is more difficult than calling bullshit on a 5-year-old, right? So so that's the evidence of you actually needing to find out what is not right, and especially within an expert domain like healthcare, these large language models can be very, very convincing. We believe that we need a better and safer AI. One of the ways to build better and safer AI is to ensure that we are constantly trying to improve on the accuracy, that we're constantly trying to utilize data sets such as the one that the Torben and the Alexander Institute has been driving forward here. Because by that accuracy and those evaluations, especially the validation side here, is really, really interesting. We can say where the AI model is not performing as well, and we can inform that to the end user or the recipient in any way or form, such that they're at least knowledgeable about the system's potential inaccuracies. Yeah. Basically, healthcare has a lot of use cases, and when you dive into it, for the ones that have visited the healthcare system a lot, they know. But for a lot of the healthy people out there, it comes as somewhat of a surprise when you go into the radiology field or the endoscope field and so forth. You find out how many terms and different complexities there are in the workflow, and how much you actually need to make sure that the AI can actually encompass. It's not just training on a lot of YouTube data, similar to the Whisper version 3 model, and hope for the best. No, these models need to really be fine-tuned towards the domain. What happens in a lot of AI applications out there is that we're trying to use a mass-produced model, similar to using a mass-produced cooking ingredient for our kitchen here, and then we're trying to plate it in a nice way, and then the demo looks fantastic after the plating and all of that. But when we actually get into reality, it doesn't look as great. And that creates frustration from the end users, and that may create disbelief and all of that. We see it all of the time out there in the healthcare field, and the end users are right. It's not just something that I say. The plating really looks grim in reality when you start looking at some of the mistakes that the out-of-the-box AI solutions can have a tendency of doing. We've placed our company in the infrastructure layer because we believe that within an important field like healthcare and military and so forth, in all of these fields, there are the need for infrastructure players that can build AI solutions towards these verticalized solutions in order to ensure that it's not just a mass-produced AI that is fine-tuned on YouTube data, but it's a specialized AI that is exactly the ingredients needed for plating a nice healthcare solution. That leads me to, let me just see here. Basically, gonna give you a quick scope. I'll turn it into Q&A session soon, I promise that. So our website is stating naturally here that we are building AI for every type of vendor outside in the healthcare field. We are giving AI solutions for anything ranging from inpatient hospital settings, so really complex inpatient hospital settings where they need coding, they need support on the ambient documentation, so automatically document, they need dictation solutions, they need summarization capabilities and all of that. And we provide basically the plugs to include that in whatever software application out there, whether that's their electronic health record system, their radiology information system or whatnot, their business intelligence system. Our AI solutions are funneling all of that, and we are similar to OpenAI, just focusing on the workflows of healthcare. That leads to you can get up and running easily using our models and so forth, and using our by hooking up to our API. You can see all of the languages that we support. More coming out soon. This leads me to this CoRal dataset. We have been in dire need for better and better Danish data, because we want to ensure that we can support applications such as this. Here is an example of an ambient documentation tool built on our API, where you can basically see that we have transcribed the entire conversation, and then we have extracted the facts, we call it, the contextual information for that conversation, and then our AI can create a SOAP note and all of that. Back to the 35% spent on administrative burden. This we believe that we can alleviate heavily by a solution like this, such that the physician, instead of looking into their screens, they can basically just have a face-to-face conversation with the patient. We listen in and we do the rest of the burden automatically, listen in on the microphone, document, transcribe, and all of that. Letting the physician visit the note afterwards and seeing if there are any last complications. They can use the AI chat over here to get support with coding and explainability and all of that, and then they can hopefully send the note out and spend 2% of the time instead of 35% of the time on the patient. You can do a lot with this. This is giving an input from our API testbed, like basically Playground, where you can do any language modeling task. You can do ICD-10 coding and all of that. On the CoRal data, we have just finalized. I don't think that Torben is even. You don't have the inbound on this. We've just finalized the ablation studies on the CoRal dataset. We've had some issues because healthcare is very verticalized. As said, in Denmark there are a lot of doctors also with accents, which is back to the need for more doctors. The countries are fighting for getting more doctors into work within their countries and all of that, and that means heavy dialects and accents. So we've done a sub-segment. We had a lot of healthcare related data for our speech recognition system. Then first and foremost, we put in the CoRal dataset and hope for the best. We didn't see this. We didn't see an absolute big significant impact, but after doing some ablation tests, we can see an absolute significant impact, especially on these more dialects and so on. We just don't have enough representation. And that's a good reminder towards doing proper validation on these datasets and these models that you need to dive in deep, and that we have done and found out, especially for the hospitals on the outskirts and so forth, we see a much larger impact from using this CoRal dataset to make our auditory model better. So that means that our auditory model, in terms of actually understanding the pronunciation of stuff, and then that in cohesion with our language part of the speech recognition model is giving significantly better results for these more dialect and accented speech patterns. We've also found with the latest iteration that our absolute word rate and character rate and so forth is actually improving, and also we have found that the absolute word rate and character rate for the medical terms are improving. So that means that we can actually get some of the dialect and so forth, and the accents from the recorded samples at the libraries. where these recorded samples, they have not been sitting and reading out loud a medication list, but even in that instance here, we can incorporate some of these auditory features and map that to the very verticalized library and see impact, which is powerful. So it has definitely helped us to improve the stability of our model, such that we hopefully prove a better model and better accuracy for the future. Our version 3 Danish model is coming out right around the corner. It's being tested in staging, so we're quite excited about that, and that is based on the CoRal dataset.
Well, thank you very much, Lars, for making us all a little more knowledgeable here. I have a question. I think this is mostly for you, Torben, but you're also very free to chime in, Lars. But it's from Oliver, who's asking, what experience do you have in using other general AI to post-enhance the transcription value of your roast model by guessing / estimating words and sentences?
Yeah. We haven't been using other models to post-process as such, but what we have used other models to actually validate our read-aloud dataset. So just to make sure, and especially sort of to increase the quality of the dataset, and well, basically just to weed out the mistakes in the dataset, we've used alternative solutions to actually sort of validate all the recordings. So we actually post-process the recordings and see and actually compare them to what is expected to see. So basically, you could say we use other tools to ensure that people actually say what they were intended to say when they were doing the recording. So that's where we have used other tools, but we haven't used other tools to actually sort of post-process the quality of, for example, the transcriptions. That is purely a manual process by real people.
Thank you, Tom. And now, if you have questions out there in the audience, please leave them in the Q&A, and Lars and Torben will be happy to answer. Now, I can't help wondering, like, this is the second time we're hearing about your progress here at the CoRal project, but how far ahead do you see the end finish line of this project, or do you see it more as a ever evolving kind of thing without any clear deadline?
Well, we do have a deadline as such as the project is running out, but we are of course looking into see if there could be kind of a follow-up to this project. I see it as a never-ending thing, because the data is the bread and butter of AI. So we need more data we can improve to a certain point, but we just need more data, and the more data we get, the better our solutions are going to be. So we need more data. So I hope that there will be other projects that can participate in this, and I can just maybe on a side note to this say that we are part of another project that is focused on something completely different, because it's something about sort of doing some identification of dementia used on speech in another project, where we're actually going to take these CoRal data and add some, let's say, emotional tags to some of the dialogues. So some persons are actually going to sit and listen into all the dialogues here and add some emotional tags to the data set, so you can actually use this data set to try to extract emotional kind of feelings to some of this anonymized data. So it's another project where the data is going to be used, but apart from that, I hope there's going to be more, and we would definitely like to do more in this area. And one of the things that we are hoping for is to be able to tap into other resources of data that are available, for example, at the I know that in Norway and in Sweden they have done national whisper models based on data coming from the national broadcasters, for example. And it would be great if we were allowed to do some of the same stuff here in Denmark, use data from for example, the national broadcasters to actually improve the general Danish models and make the Danish models even better.
Well, that sounds beautiful that you can kind of use these data for all kinds of different purposes that are showing up along the way. Now, Lars, do you very, very much focused in the healthcare aspect? Do you have any sort of thoughts and ideas for other use of this? Yeah.
I think So I think that everything that we're focusing on is the user suspects, right? So if we can get better models for speech synthesis as well and so on, then that's powerful, right? We can use these data sets also for training those models and making sure that you can actually get a more varied speech synthesizer and so forth. That's something that we definitely would love more of. Some of it is some of these models are working quite well today, but getting more of this variability is also informing us. So we're going back and forth from text to speech to text and so forth, also training our models. And so that's one of the use cases that I'm very excited about. And just the fact that this data set is now recorded, there's no end to the possibilities, to quote a bad movie here. So looking forward to play around more with the data set like this for those purposes.
Sounds great. Now, Torben, during your presentation, I was wondering, I'm from Silkeborg myself, and I can tell the difference if you're from Herning, or if you're from Silkeborg, or if you're from Aarhus. Although I believe that that's dialects in the same region, as I understood. So how do you kind of decide the size of these regions and the significance of the dialect to kind of
well, we haven't actually decided that there are no dialects that are more important than others. I mean, I will not open up that can of worms, because if you talk to linguistics, they can probably spend a whole day discussing different dialects and the difference between the different dialects. So I would just say that we're using, let's say, the division of dialects that has been conducted by Copenhagen University of dividing Denmark into different dialects. I'm sure that you can spend a lot of discussion time in where they're actually separated. We were fortunate to cut it down to 7 important and 5 that we actually did. But there are major groups, of course, that are, let's say, more dominant than others. Just to take a curiosity, I mean, it's on Samsø there are 2 different dialects. Just to go into details, there's one from the northern part of the island, and there's one from the southern part of the island, and that's on an island that's 50 kilometers long.
Yeah. Okay, so let us close that can of worms before we open it, and we'll have to finish the webinar shortly here, but just maybe a final question here. What is the biggest obstacle that you see ahead in your process from now? Is there anything that you need to be extra aware of and need to solve in the near future?
I would say that sort of the biggest. I don't know if it was a surprise to us, but I would say that the transcription part has been extremely hard. It is very time consuming to transcribe sort of the dialogue data. That is it's not an obstacle. We just need to spend more time on it than expected, and more money on it than expected. So it was more difficult,
right,
to do that task. Then there are potentially going to be something on the models where we, for example, I can just add that we had something that we are looking into at the moment that we think we did quite well in the first Whisper model we released. Then we added the conversational data to our model, and then it got worse. That was quite a surprise. So that was something we're looking into now, and it's probably because the model was actually sort of being a bit skewed towards the read-aloud data set. So it's something that we need to adjust. So there's a lot of sort of really technical things that we're going to look into now as part of this. It's not always going according to plan.
Right. Now, final question here before we close is from Oliver. When do you expect to annotate the data with emotions? Is this upcoming or more up and coming or more in the future?
It is in the future. It's going to be part of another project, a 3-year project that's just been started. So and I don't know the exact time plan and to what extent things are going to be released. So I can't really answer to the details in this.
Right. So like you said, this project
But it's not tomorrow. It's not tomorrow.
Right. So like you said, this project is never ending. Let us conclude the session with that. And let me just express my gratitude and thanks to you, Torben and Lars, for coming today to share all of your great work and your data and research. Also, a big thank you to you out in the audience for showing up today. This webinar will be recorded and available on YouTube in a day or two, perhaps. So if you missed any of the action, you can go and watch the rest on YouTube. Now, have a great day, everybody, and thank you very much for showing up. See you some other good time.